Upstairs first?
No, I actually have to go downstairs first. Why? What do they need upstairs?
Asking about the broadcasting.
Yeah, okay. Tell them I'll be able to set it up. Here. You may up to you.
One, two, test. Test, one, two, one, two. Test, one, two. One, two.
right, good morning, everyone. I didn't hear. There you go, right? Good morning. My name is Professor Danielle Vivas, and I am proudly here as part of this function at Esperanza College. I've been here for about 13 years now, and I'm happy that we do events like this that can be for our community and within our community and bring education and services to all of the high schools. I'm sure we have many in representation today. I'm going to give you a little bit of a warm-up, because why not, right? Okay. Is everyone excited to be here? I will tell you, I'm going to try to look up at you, but these lights are very intense, right? So my first question here is, what is anxiety? I'm more interactive. What is anxiety? Fear. I heard somebody say fear. What else? Scared. What else? Did you say nervous? Yes, nervous. What does it look like when somebody's anxious? Disorganized. Very good, right? What else? Ooh, don't stand there. That was bright. that was very bright. What else does it look like? Nothing? Do you guys experience anxiety? Some of you, right? What does it look like for you? Go ahead. Fast heart rate. Good. There's physical symptoms. There's emotional symptoms. This is difficult for a person who talks with their hands, right? So there's different kinds of symptoms that you can experience. There's sweating, right? There's shaking. There's stomach issues, right? There's headaches. What are some of the emotional symptoms you might experience with anxiety? Crying. What was the other one? I think you said blurredness. Lack of awareness. Good one. Right? What is it? Panicking. Good. Well, it's not good to panic, but you know what I mean. Now, here's the biggest question. What are some causes of anxiety? What causes you anxiety? Trauma. I like that. I'm a psychology professor, so I definitely like hearing about trauma, right? What else? In the back. School. How many of you get anxious over school? Right? All of us still do. I see a couple professors raise their hand, right? We still do. You know why? Because anxiety is a normal human response to things. It's a normal thing. So you shouldn't feel weird or, out of place if somebody else thinks, and let me tell you something, some people are really good at covering their anxiety. They can look cool. They can be like, oh yeah, everything's great. Life is great. Awesome, right? And then they're freaking out in the corner. When is anxiety a problem? When does it become a problem? When you first get it, maybe because you're not aware of what's going on. In an emergency, right? What else? When it starts to affect your what? Everyday life. We got some, you're gonna go into psychology, right? Okay. So how do we cope with it? How can we deal with this normal human response that can take over? Because I'll tell you, when I have anxiety, I'm not one that gets the jitters or the shakes or panic or freak out. I get very irritable. My family doesn't really like being around me. I get nitpicky. Does anybody get that way? Where all of a sudden, they know I'm anxious because all of a sudden I'll be like, who did the dishes? They didn't do the dishes right. Why isn't this done? Why isn't the trash taken out? Who fed the dog? You didn't feed the dog right. I will start nitpicking. And I can actually hear myself do this. And I can't stand it. I can't stand feeling that way. So some of the things that I do to cope with it, breathing. And you're like, well, we breathe every day, right? Well, there's special techniques of breathing you can do. There's meditation that you can do. What else? What are some of the techniques that you guys use to deal with your anxiety? Hand. Listening to music. Does everybody realize that the type of music you listen to directly impacts your mood? Yeah? Anybody listen to like music that really hypes them up? Yeah? Or like workout music when you get in a rage or want to be happy? Music is a good one. What else? Meditation. How many of you have tried meditation and you're like, I can't do this? Why can't you do it? Why can't you do it? You just hate it? Is it because you think the idea of meditation is sitting still for like an hour and just being like, The key thing about meditation, small spurts of it at a time. If you get a solid minute, you're great. Because then tomorrow you can get 2 minutes. And the next day you can get 3 minutes. Right? It's a way to quiet your mind. How many of you guys are sensory? How many of you like soft, cuddly things or certain senses bother you? Right? Certain textures really irritate you. Styrofoam really bothers me. And chalkboards. I can't do it, right? Everybody get a bag when they checked in. Can you reach in your bag? There should be a cool little figure 8 sticker or some shape of a sticker. And it feels, there's like a tactile on it. There's like a type of material on it. If you found it, can you hold it up? At least they told me it was in your bag. Yes, I believe that's it. Does it feel like there's like a velvety, right? Yeah? So these stickers are to be placed on your water bottle, your laptop, your phone. And when you're in the moment of having kind of like anxiety and you're having a moment where you're stressing out, you can help use that sticker to trace your breathing. You didn't get a sticker? Some of you didn't get stickers? All right, we'll figure that out. All right? So what I want you to do is for people who have that sticker, I want you to place it on your lap or on your laptop or wherever. And I want to teach you something that is very helpful. This is called 4 square breathing. It's a grounding technique when you start to feel like you're freaking out. Because let me ask you guys, when you're freaking out, how are you breathing? Real fast, right? Like rapid, shallow breaths, which means, how many here love science? What's happening to your brain when you're breathing shallow, rapid breaths? What are you doing? You're hyperventilating. What's going on with your brain? You're not getting enough oxygen, which automatically, in a physiological state, is putting your body into a deeper state of panic, right? So what you do is, we're all going to do this together, all right? Let's see if I can lead. I don't know how many people are in here, but let's see if we can do this together. The key thing about 4 square breathing is to slow down your nervous system and to reset your brain and to get enough oxygen. So what I want you to do is, I'm going to count to 4 at each step of this, and I'm going to tell you what to do, and you can slowly trace that sticker. All right? Everything good? I want you to take a deep breath in, and you're going to hold for 4. Ready? We're going to breathe in for the count of 4. 1, 2, 3, 4. Now you're going to hold it for 4. 1, 2, 3, 4. Now you're going to breathe out for 4. 1, 2, 3, 4. You're going to keep doing this until you can regulate yourself and feel calmer. Now, quick question. How many hugs a day do you need to survive? Listen, I want to hear from the people who say, I don't need to be touched. Physiologically, you need to be touched. Okay? How many hugs do you need to survive in the back? How many? 5 to 10. Actually, for survival, you need 4. For maintenance, you need 8. And for growth, you need 12. And I don't mean just a hey, here's my friend. That kind of hug. What kind of hug do I mean? Something meaningful, right? Something that gives you the feels, as you guys say, right? Why do you think hugs are important to deal with anxiety? A sense of affection. What is it, hon? Comfort, right? It also does this really cool thing. It resets something called your vagus nerve. So to simulate a hug, let's say you don't like a lot of people, right? It's true. Some people don't like a lot of people, or you don't want to be touched by people. I want you to take your hand, and I want you to place it right on your chest, right here. And I want you to take a deep breath in and let it out real slow. And if you hold it there for at least 6 seconds and count to it, you're going to notice that your heart rate slows. You're going to feel calmer. You're going to feel better. And it's going to help you to reduce your anxiety. My hope is that when I walk around the city of Philadelphia and see a bunch of students randomly like this, I will know what they're doing.
You didn't reply to me.
How many of you get panic attacks?
Catch my breath.
What is a panic attack?
They said that they didn't add the time.
Can you
to the
describe it for anybody?
presentation And asked if you could add it. Because
Hyperventilating. What else?
I told her there's a
Shaking.
clicker on the podium.
What else?
They said no.
Getting overstimulated.
No.
Absolutely. Where too many lights, too many noises, too many sounds, right?
So I can turn off the projector.
So I will give
They
you
can
guys
fix
a
it, and
quick
you can let me know
fix
when to turn
on
the
if you're
projector back
going to
on.
have a panic attack
But no, I'm
and
not
you feel
coming
like you're
downstairs
going to
to do
like melt down.
That might be what
Do you guys like Sour Patch Kids? Pop a handful of Sour Patch Kids in. It's another way to reset the vagus nerve and you can stop a panic attack. You have ice cubes. Ice cube on the back of the neck,
You know, just go let her know.
right?
Like,
It'll
she
help
can reset the
reset you
timer.
for a panic attack.
But that's the best thing we can do.
So what do you think is the
What are we
most
gonna do?
helpful thing that you can do
Which one are we on?
to avoid having anxiety in your life?
Ozzy will be here in 15 minutes.
What use is it now?
You can
Anything.
cover Grand Salon.
I mean, we're going to have things that disrupt us, right?
Yep.
We're going to have things that disturb us and give us anxiety, right? So what do you think you can do to make preparation? Talk it out, right? Don't hold it in. Learn techniques that you can use. What were some of the techniques I mentioned today? Breathing. What kind of breathing? Four square. What else? Hugging. What else? Sour Patch Kids. Good. What else? Ice. Meditating. And if you don't have someone to hug, hug yourself, right? Hopefully you guys will be able to deal with anxiety as you move forward in your future, in
And she
finishing
never gave me
school
the times.
and
So
in
I'm
choosing your
supposed to
careers. And the biggest thing to know is that you're not alone when you feel anxiety, and you don't have to be alone in experiencing it,
I don't have a
and you can
run
always
or a
ask
time
someone
or a
for help.
timer. So
Thank you guys for doing the warm-up with me, and welcome. I hope you enjoy the symposium.
We were not supposed
And I
to
hope
be
you have a
running
good day.
slides. They asked for a slide setup. Someone from her team needs to run the freaking slides. It's that simple. Ask her, does she have someone that can run the slides? Because we were not told that we were running slides on our end.
All right. Good morning,
Oh, she's the one that
everyone.
asked?
I know it's early. Good morning, everyone.
Okay. Well, talk to Nilsen.
My
Let
name is
Nilsen
Christine
know.
Nieves, and I am the Senior Vice President of Development for Esperanza.
I know,
And
she
on
never
behalf
knows what's going on, 'cause
of
they're not used to
Reverend
running
Luis
shows, and
Montes,
when I try to set
Esperanza
all this
founder and
stuff up,
CEO,
they don't wanna listen
Dean
to me,
Marilyn
it's like, I
Marsh
don't
for
know
the
what I'm
college,
doing.
and all of us here, I'm here to officially welcome you to the 2024 Minorities in Health Sciences Symposium.
Well, no, just walk
This
up to
is our
to
8th
Nilsen,
annual
tell her
event,
the blue
and there are
dress
16 schools
Yeah,
represented
let her
here
know
today.
they
So
need
I was
someone
going to
from their
list and
team
shout out all of you, but that's
to run the
16.
slides.
So
Because
we're
that's not
excited to
easy.
have
We
you
don't
all
have staff
here,
to do
and
that.
thank you for being here. To see each of you filling these seats, it's why we exist, and it's what Esperanza was built for. Since we first opened almost 40 years ago, we've been on a mission to make sure that our community, all of you as students and your families, have the very best resources to pursue your dreams. 25,000 people walk through these doors each year to find new opportunities, and it's our commitment to create spaces for minorities to lead the solutions to the challenges that face our communities, with the perspectives and the experiences that we bring. It's a mission that can transform generations and our neighborhoods. These halls, these labs that you're going to see, these presenters and role models all reflect the excellence that we hold as our standard. Now more than ever, our community needs to see themselves reflected in the spaces that they turn to for wholeness and health, to see that STEM fields hold the possibility to bring real benefits to their lives. You have the ability to do that, to bring that hope, to pioneer and to innovate, to create, and you belong here. We hope that you will always know that Esperanza College is a resource with career days, dual enrollment and early college programs, an Associate of Sciences program, and more for you. Probably like many of you, I remember what it was like being the expression of my family's dreams. Years of collective struggle, all summed up into one. Translating for Abuela in doctors' offices and holding the pride that they all had in me. It can be overwhelming at times. We need networks and people to open doors for us and to let us know that we are not alone. Esperanza is that place here for you. As you enter each workshop and listen to each speaker today, it is our desire that you find that thing that inspires you forward with clarity and determination. Here at Esperanza, we call those transformative moments, and I hope you find them here today. Now, I do want to thank our sponsors, because that scrolling slideshow is not quite working at the moment. So I just want to give a shout out to our lead sponsor, Healthcare Improvement Foundation, Cities for Better Health, our gold sponsor, Santander, silver sponsors, Aetna, Jefferson, Independence, Penn Dental Medicine, St. Christopher's Hospital for Children, our bronze sponsors, Drexel University Urban Health Collaborative, Dornsife School of Public Health, Penn Medicine, Philadelphia College of Osteopathic Medicine, Temple Fox Chase Cancer Center, and our advertising sponsor, Pico. All of these folks are behind you. So thank you all for being here, and we hope you have a wonderful time.
Good morning, everyone. How are you doing? So look who's here. How are you, Beaker? Huh? Are we excited to have Beaker here? This is Beaker, Eastern's mascot, Eastern University's mascot. And I think that Beaker is really excited to be here for the Minorities in Health Sciences Symposium. Yeah, very good. And we're very excited to have all of you here. So very good. So Beaker, I have a question for you. Do you like science? Good, good. And do you like healthcare? Yeah, very good, very good. Are you going to come to Esperanza College and study with some of these students in the future? Yeah, very good. Well, thank you for being here, Beaker. All right. Okay. So it is my pleasure to introduce our first speaker for the morning, Dr. Kambisi Etemad. He is a psychiatrist, an educator, as well as an author and amateur musician. He went to the university and medical school in Rhode Island and did his training in psychiatry at Temple Hospital in Philadelphia. He has a wide variety of work experience in both mental health care and in education. He recently started a training and consulting company called Talisman Development Services. And his talk today is My Struggles and Joys as a Psychiatrist Who Doesn't Really Fit In. Welcome.
I'm genuinely honored to be here at Esperanza and to be participating in this program. My name is Kambiz. My daughter says it rhymes with zombies. It's an old Persian name. I'll tell you a little bit about where all that comes from And in case the slides don't work, I'll bring up my notes. I was asked to basically share a little bit of my own story, professionally, personally, and a little bit about what my work has focused on. And I just sort of wanted to be just very straightforward, no airs, and just start off by saying, you know, what we all know. Life sucks sometimes. It can be very, very hard. And sometimes when it's really bad, it's normal bad. Like life is just can be that way. And there are other times where the bad is more than normal. It's severe enough where it might need special help. But whether it's normal or not, we all need help, whether that's from our friends, our family, from services or professionals. Learning how to ask for help. I'm now in my late 50s, and it took me a long time to realize that learning how to ask for help is one of the most important attributes we can have as human beings. And it's sort of like the psychological version of getting a hug. So what do? I'm a psychiatrist, and a psychiatrist is basically a medical doctor who focuses on mental health issues. And as a psychiatrist, we're trained in medical stuff, but we're also trained in psychology and therapy techniques, so we can do both therapy as well as prescribe medications, which is different from a psychologist who's really drills deep on understanding psychology, and frankly, they are the better therapists. I'm also an educator. I studied the field of education. I love learning. I love to be part of other people's learning, whether it's teaching or putting a program together. And I've been lucky enough to do both of these kinds of things in my life. In terms of my own background, I was on the doctor path, and the doctor path involves 4 years of college, 4 years of medical school, and then I specialized in psychiatry, which is 4 years of training specifically in psychiatry. And then I've worked in various places in the greater Philadelphia area, all the way up into the Lehigh Valley area, in West Philly, in North Philly, in the Northeast, out in the suburbs, in different hospitals and clinics. And I've done everything from therapy to work in addiction treatment to helping people who are in psychiatric hospitals who are homicidal or suicidal get stabilized and feel like they can move forward. So it's a very rich, scary environment. And of course, there's the joy of helping people, but there's also the joy of working with great people, and sometimes the pain of working with terrible people. Now, along the way, when I was in medical school and when I was a resident, I became aware of other things that I really love to do more than I was interested in medicine. And it kind of put me in this really bad place where I quit medical school once, I quit residency once. Like, I've been in and out, and I've jumped from 2 different fields because my passion is to be an educator. An educator doesn't just mean like I want to teach in a high school or I want to give a class. It's about walking people through the process of discovering themselves and becoming the best people that they can be. And that was just my passion. So I've had a very weird career. I've jumped back and forth between these two, and a lot of times I was just following my instincts. Like, I just sort of felt like it was time for me to be doing this, and then it was time for me to be doing that. And sometimes it was in medicine and psychiatry, and sometimes it was in something kind of weird. But the biggest part of what I've focused on has been psychiatry, and psychiatry focuses on mental health. But the interesting thing about mental health is that a lot of the things that we treat in mental health care, anxiety, sadness, depression, no motivation, having thoughts that, freak you out or whatever, they're not always an illness. A lot of times it's just normal human stuff. It is totally normal to experience every kind of thought and feeling. Sometimes it's normal to be paranoid. Sometimes it's normal to see things and hear things. A lot of times it's a normal warning sign to feel panic because it's your body and your mind telling you something you might need to pay attention to. So one of the biggest lessons about mental health care is not everything needs a therapist or a doctor. And the important thing is just learning to accept what you're thinking and feeling without necessarily putting it in the driver's seat. You don't have to do anything about it. Just let it be there. Talk it out with friends. Talk it out with a trusted person in your life. And then if it's more than the normal, then you do something about it. So that was one thing. But there's all kinds of things. So I just sort of made a short list. It would have been on the slide, but I'll just read the list. Stress. Stress can be normal. It can become destructive. Trauma. Trauma, most of us live in a world where trauma is inescapable. It's part of everyone's life in one form or another. The need for being connected and feeling very disconnected from others. Loneliness. Loneliness is something that everybody deals with at some stage in their life. And for some of us, the isolation that becomes bigger than it should be, and we need help figuring out how to get back connected with people. Apathy, which means you've got no energy, you've got no vitality, no interest, no motivation to do anything. Totally normal. You're burned out. You're tired. End of the day, end of the week. You've had a bad situation and you're burned out. And sometimes you just need to sort of sit back and do nothing and let yourself do nothing. But then there are other times when apathy goes on for too long or it affects too many things and your ability to actually function drops. And that's when it's a concern. Worrying, social awkwardness, anxiety, panic, post-traumatic symptoms, OCD, attention and focus problems, mood and depression, trouble controlling your impulses, not picking up on social cues in your environment, disorganized thinking, not caring for yourself. And then this is where it starts to get to the point where some of these things are generally something that needs to be looked at professionally. Aggression that is directed in every direction. Agitation, destructiveness, suicidality, and homicidality. This is just a small menu of the kinds of things that mental health care addresses. But like I was saying, a lot of these things are normal human experiences, and it's for everybody. And I'm sure most or all of you have experienced one or more of these. I've certainly experienced plenty of these. And I wanted to share, I think I'll share it now. I actually, when I finished medical school, I was a hot mess. I actually had full-blown symptoms of obsessive compulsive disorder. I won't get into the details, but my dad is a psychiatrist, so I consulted with him and I consulted with some people, and I got put on medication and I got some therapeutic intervention, and absolutely nothing helped. And I basically thought, I almost said holy shit. I just did. I was like, holy shit, I've got OCD. I'm not going to be able to function in my career. And long story short, I brought music back into my life. I'm a keyboardist. And I started playing again, and I started to sing again. And my symptoms, over time, it didn't happen immediately, but they melted away, and I didn't need to be on the medication, which wasn't working anyway. And I'm not saying go out there and, rock out because you're going to cure mental illness. I'm saying human beings are complicated. And sometimes it's because something's screwed up in the brain. And sometimes it's because something is missing in the soul. And it takes an open, honest look at what we're made of in order to do that. But I shared that with you to say that mental health care providers also get mental health issues. And part of being a good caregiver is owning it in yourself and doing something about it. So I was asked to share some positive and negative experiences in my career. So the most negative experiences is I had the shit beat out of me twice. It wasn't long, but I got assaulted, punched in the head by a very, very unwell individual. I was working at Temple at the time, and I literally woke up and didn't know what happened to me. And, he hit me closed fist with a full swing, full force, and I woke up maybe 30 seconds later, and the nurses were saying, "Dude, you don't whack the doc." And I'm like, is that what just happened to me? So that was one of the worst. Another time I was involved in helping to restrain a very agitated patient, and the patient grabbed my tie and pulled me down onto the floor, and I hit my head on the floor, and I became part of the problem that they had to fix, which is why I never wear ties anymore unless I'm going to a wedding. So some other really scary stuff, or not scary, some patients are very difficult because they don't want to take responsibility for the part that they have in getting better. And convincing a patient that it's not all just about the right medications, but you kind of got to do your own psychological work, that can be very, very challenging. And then another very challenging situation are people who lie. There's a certain number of people who will make up stuff and come in to get mental health care because they see it as a way of getting something else. So, sorting out the very small number of liars from all of the people who really are suffering, that's a challenge sometimes. Some of the positive experiences I've had, I had one woman who came and she seemed to have bipolar. Her mood was up and down, and she was aggressive and very impulsive, and she had been tried on different bipolar psychiatric medications. And I met with her, and I took a lot of time to understand her story. I met with her husband, and what I realized was that I don't think this woman has bipolar, and she's been given the wrong diagnosis and the wrong medications. And it turned out that this woman had a hormonal problem. PMDD, it's called. And basically, I took her off her medications gradually, and I fought and fought and fought with the insurance company to get her to meet with a hormone specialist, a reproductive endocrinologist. She got put on the right hormone medication, and she never had psychiatric symptoms again. So my greatest successes and joys sometimes are getting people off of stuff they never should have been put on. And in the field of psychiatric care, there's a lot of stuff that people are getting put on that they shouldn't be. So, getting the right diagnosis and sometimes cutting back the meds is a great thing. I also love working with teams. I worked with Danielle at a hospital in West Philly, and being in that team environment where people have got your back, and you really grow to love the people that you work with. There's nothing like that in whatever work that you do. Okay, so what are some of the non-typical struggles and joys that I've had in my life? My parents are from Iran. They moved from Iran in 1961, partly to start their medical careers and partly to escape religious persecution. So I was born at Temple Hospital. I grew up in the area. And I was in middle school when the Iranian Revolution took place and the American hostages were taken. So I remember growing up living with, death threats and physical threats at school. I can't claim to experience the same level of prejudice that a lot of people experience, but I remember feeling that fear. I'm also kind of, I don't know if you ever heard the term HSP, highly sensitive person. It's a certain type of psychological temperament where you're just super sensitive, physically as well as emotionally. And it's, it makes life very rich, but it can also be very, very difficult. And I learned this about myself more recently and realized that a lot of my challenges in my work environments, in school, was because I was an exquisitely sensitive person. And I love it because it makes me very artistic and musical, but it also is a liability, and I've had to learn how to protect myself without putting up too much armor. And then I think the other thing that I experienced that made me sort of not fit in was I'm part of a religious identity that is kind of weird. It's not very well known, and it's persecuted over in Iran, but even here in the West, it's just not very well known. So it's very hard to explain sometimes, and sometimes you don't have the energy to explain. And it does shape the way you think and how you feel. So when you make decisions that are a little bit different, people don't know what to make of it. And so a lot of my struggle wasn't necessarily because of my ethnicity, although there was a little bit of that. It was more because I think about things differently. And the healthcare environment and the schools, they don't always embrace different ways of thinking. And that can be very difficult. But, I'm the kind of person who likes to take the best of everything, and I have a lot of interests. I'm in mental health and science. I'm an educator. I love music. I love to read. I love to write. And I like to bring the best of all of these things together and do something new and do something different. And I've had a chance to do that as a psychiatrist, and the patients seem to love it. The team people that I work with seem to love it, but not always the administrators. And there have been times that I've had conflicts with my administrators because I'm trying to do something new, trying to do something different that's just might work better for people. And I think that's a challenge of being of diversity. It's not just that you have a different color skin than the other people in your classroom. It's not just about coming from a different cultural background. It's that what you bring to the table in the workplace is that you think differently. And we live in a society that talks about diversity, but it squashes diversity of thought and diversity of temperament. And the challenge and the victory is about bringing your best different ideas to how to solve problems and make people's lives better. That has been my challenge. So let me just wrap up by saying, what can you do to address mental health in general? One, learn about it as much as you can. On the internet, TV programs, take a class, whatever it might be. Learn about mental health. Look. Just keep your eye open. Look at yourself. Look at others. Pay attention to what people might be going through, that we are all basically the same because we're all having similar struggles. And then if it's something to be concerned about, then do something about it. Own it. Don't be ashamed. Recognize that it's just something that needs to be addressed. And I think that, not to get philosophical, but I think the best thing to do for one's own mental health is take the time to know your own best self and trust it and follow it. Like Tracy Chapman says, all that you have is your soul. And I think that really it sounds trite, but it really does make a difference in terms of fostering mental health. So thanks for listening to me ramble, and hope you have a great day.
Thank you, Dr. Edemat. We do have a group of students that came in, so we're going to give them a couple minutes to set up. Thank you all for your patience as we work with these issues that we're having with the slides. So just, do some deep breathing while the other group comes in, okay? You got it? Huh? We have them now. All right. So, Beaker, are you learning something? Are you learning something? Yeah. Students, are you learning something? Good, 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 good. So I am going to go ahead and introduce our second speaker. We are running behind a little bit because of all the issues that we've had, but we wanted to make sure that, that the opportunity was open to as many students as possible. So please hang in with us. Our second speaker for today is Mr. Marcus Henderson. He is MSN RN, and he's also a PhD candidate at Johns Hopkins School of Nursing. His clinical and research interests are in adolescent mental health, suicide prevention, family systems, the social determinants of mental health, and advancing diversity, equity, and inclusion, belonging, and anti-racism in healthcare. Mr. Henderson is a dynamic psychiatric nurse and leader with professional experience as a clinician and educator in community-based acute psychiatric and academic settings, including lecturer and clinical instructor in the Department of Family and Community Health at Penn Nursing, and a staff nurse in child and adolescent inpatient psychiatry in Philadelphia. He holds various national leadership roles, including immediate past chairman of HOSA Future Health Professionals. Any HOSA members in the house? Yes. An inaugural member of the National Commission to Address Racism in Nursing. He previously served on the American Nurses Association Board of Directors and National Academy of Medicine committees on the future of nursing 2020 to 2030, and exploring a culture of fairness, respect, and anti-racism in health professions education. He holds a BSN, MSN in health leadership and a certificate in healthcare innovation from the University of Pennsylvania. And the title of his talk is Student Nurse to Nurse Advocate, a Journey of Learning, Leadership, and Action. Welcome, Mr. Henderson. The clicker is here.
Okay. Does it work? Good morning. All right. Good morning. I heard one person. Good morning. Good morning. All right. All right. Oh, they're working on it. So we're going to keep going. How's everyone doing this morning? I think I'm going to take this out because I'm a little tall. Now we're going to try that again. Raise your hand if you're a HOSA member. A little higher? All right. Welcome. It's great to see everybody. See some familiar faces, some HOSA advisors and students. So I hope to see you at the Penn HOSA State Leadership Conference coming up this March. But it's a pleasure to be here. It's an honor to have been invited by Dr. Graziani to speak with you this morning about my career journey and just to offer some of my advice. Oh, there we go. Now, I have a lot of slides, but we're going to go through them fast. I was telling my colleague here, this is usually a 75-minute presentation, and I cranched down into 20 minutes, so we're going to get through it. And you've heard a little bit about me, but I think it's important to really tell you about who I am, because this is how I show up every single day. What my values are, where I come from, how I engage with people, how I interact with patients, how I conduct my research. So this is who I am. I'm a son, I'm a partner, I'm a father. My son's 9 months old, so totally different perspective on the world when you have a child and a small human that you have to protect. And I'm a caregiver. Like many of you who want to go into healthcare, I decided to become a nurse because my great-grandmother had dementia, my great-aunt had Down syndrome, and when I was in middle school, I took care of them every day after school. Bed baths, medication administration, you name it. I basically was functioning as a home health care nurse at the age of 10, 11, and 12 years old. And that is core to who I am. I'm biracial. I'm a first-generation college student raised by a single mother, Community health and psychiatric mental health is my background, so I think we're sensing a theme from our activity this morning to our colleague who just spoke and myself who's in psychiatry. And I also am an educator, a researcher. And I love mentoring students, hence why I asked how many HOSA members are here, because that's core to who I am and how I got started. So don't mind the embarrassing photos, but I had to find pictures. So I think it's important to start off that my journey started not only as a caregiver, but in CTE education in high school. So how many people here are in a CTE program or have been in a CTE program? Wow. So you all know, I mean, let's give a round of applause for CTE education. Yes. So you all know what I'm talking about when I say that CTE education and HOSA are really what jump-started my career. I always knew I wanted to be in healthcare, but it wasn't until I joined my CTE program. Mrs. Jessica Way, who's here, was my HOSA teacher, advisor, CTE teacher, and really my first nursing mentor that guided me on a pathway that I'm still on today. So it's often said that like people often see things in you that you never see in yourself, and that was, well, Mrs. Tax. I have to correct myself. Mrs. Tax did for me. She saw something in me, and I'll never forget. She said, "You're going to be a nurse. I want you to apply to Penn Nursing." And I looked at her like she was crazy. I was like, based on where I came from, my background, I was like, that is not my trajectory. That's not my path. I'm not going to get into an Ivy League school. I just want to get into a nursing program, get in, get out, because, you know, my mom can't afford it, and we just need to kind of get these things together and get going. And she said, "No, you're going to apply." And I remember I applied the day the application was due, and I got in. And so I got into Penn Nursing, and it was like, wow, okay, Marcus, single parent, low-income household, is going to one of the top nursing schools in the world. And I'll never forget, my first week on campus, I did a summer program where students from similar first-gen, low-income, diverse backgrounds go for a month before college to figure out, okay, how are you going to transition to this environment? And I remember calling her a week into school being like, that's it, I'm done, I am leaving, I am quitting Penn, this is not for me. Everybody's talking about their daddy's credit cards and how they got perfect scores on the SAT, and I'm leaving. Like, I can't be around people who don't recognize or value what I bring to the table or where I come from. And she was like, wait, hold on. Wait till you get to the School of Nursing. Once you get to the School of Nursing, everything's going to be great. So, of course, I listened to her because I've listened to her before, and she hasn't steered me wrong. And I still listen to her today. And that's when I found my community and found my home. So I was involved in a lot of different things when I was on campus. So I just tried to get to, that was when I got to meet the Surgeon General his first time in office. So I got to do a lot of really cool things, get involved in leadership, the Student Nurses Association, get involved in research, health equity research on campus. I was able to, as you saw there, meet the Surgeon General, take a trip to Washington, D.C. All of these experiences that really guided my path to where I am today. And I think one of the most pivotal experiences for this, does anyone recognize this building in the top right-hand corner? That's Kensington Health Science Academy. When I was in nursing school, my senior year community health nursing rotation, I was assigned to a school nurse at Kensington Health Science Academy, and that clinical experience changed the entire trajectory of my career. I thought I wanted to be a geriatric nurse practitioner because I cared for older adults as a young person. And then I was placed at Kensington and realized, and my professor told me, people come to the hospital from a community, and where do they go back to? The community. And that was so powerful to me because it really made me passionate about we need people to thrive and survive and live in their community. So being at Kensington Health Science, working with a school nurse, being in a very non-traditional healthcare role. Obviously we did, sick visits for kids when they, had a stomach ache or a headache. But really, it was much more deeper than that. It was about the things we were talking about this morning. It was the anxiety. It was the depression. It was the things that were happening at home that were manifesting as physical complaints. So it really taught me that there's so much more beyond just the diagnosis and the complaint, but what's really happening in a person's life. And that really was a pivotal point in my career. So My one piece of advice from this experience is really discover your passions and your interests. You know, high school and college for me were very exploratory, figuring out who I am, who I want to be, what's the change I want to see in the world. So I encourage you as high school students and college students, take this time to just explore, figure out what you like, what you don't like. Because that was so important for me. Never turning away an opportunity. Because you never know where it might lead you or, kind of the network that you're going to build. The other piece of advice would be find mentors and sponsors. I think, we all probably have that one mentor in our life, but it's okay to have multiple mentors in your life. Because, and mentors are going to change as you grow as a person, as you get older, as you start your professional career. I have many mentors. This is just a few people that I probably call on a weekly or monthly basis. But I always ask at least 3 people for a piece of advice, and then I try to triangulate. Okay, they each said this, and this is kind of the core message that they're saying to guide kind of my professional decision-making or my personal decision-making. And the best mentoring relationships are reciprocal. So it's not just your mentor is teaching you and guiding you, but at the same time, your lived experience as a person is also teaching and guiding them to be a better mentor or how to mentor other people. So it's this reciprocity, and I don't like to say mentor-mentee, but it's really mentor-mentor. Because you as a young person, you might not have a credential, you might not have a college degree yet, but you have life experience. No one can take that away from you, and I know our speaker later in the afternoon is going to talk about lived experience, so I won't get all into that. But, that's your expertise, and own it, and that's really important. The other piece of advice, I know I'm going quickly, but there's just these pearls of wisdom that I wanted to share, would be in high school and college, I really learned the importance of self-reflection. Self-reflection, becoming self-aware, and how that also promotes your own professional growth. So it's important to seek feedback from your mentors and others, being open to receiving it, listening rather than immediately reacting. That's something that I learned the hard way numerous times, especially in an inpatient psychiatric setting. Sometimes patients don't want to hear what you have to say. And you get hit or something like that. So I could share a lot of war stories too from my time working inpatient. So listening is so important, hearing what the person is saying. Because there's the way that we see ourselves in the world, and there's the way that others see us in the world, and it's our job to kind of manage and understand those two perspectives of how we view ourselves and how others view us. So that self-reflection is key as you move forward. And you'll find that, you'll be in different professional experiences in your classroom or in life where kind of, that anxiety happens or that immediate gut reaction to yell or respond in an angry way. And sometimes this is a great way just to pause, reflect, check ourselves. Why did I react that way? What did that person say? Why did I feel this way? To kind of help us keep growing, because a lot of these experiences are going to happen every single day when you're walking down the street, when you walk into school, when you walk into your job. So that constant self-work and self-growth are tremendously important. So after nursing school, I was awarded a grant from the University of Pennsylvania to start a community health worker program at the Bethesda Project Emergency Homeless Shelter off of 10th and Callahill. And 22 years old, $100,000, go change the world. And it was an amazing experience that changed my life to help mostly adult men, mostly adult black men, navigate the healthcare system, navigate mental health services. But really, it was much more than that. And I'll share a quick story about one of the men we care for, and again, how this kind of informs the way I view the world. So we focused in 3 buckets: case management, health education, and appointment counseling, more one-on-one intensive support, where our CHWs would actually go to appointments with clients and participate, kind of helping them to become their best advocate for themselves. So we never took charge of anything. It was how do we build that self-agency in the client to advocate for themselves. And we worked very closely with the social workers at the shelter. And I remember getting assigned one client, we'll call him Mr. D, and they said, He's got co-occurring mental illness. He's got all these physical health conditions, diabetes, high blood pressure, you name it. He had all the kind of staple comorbidities and chronic conditions. And they said, good luck trying with him. He's not going to talk to you. He's not going to engage. He's not going to want to do anything. So we haven't been able to be successful. So they just gave up on him, basically. So we said, sure, we'll take him on our caseload. We assigned him to one of our CHWs that really had an ability to kind of manage individuals with that kind of candid, direct, resistant personality. And every week we showed up. Hey, Mr. D, how you doing today? I'm your CHW, or I'm Marcus the nurse. We're here when you're ready. Okay, yeah, you're not going to be here next week. All these programs come in, they say they're going to help us, and then the next week they're not there because they were a student or a volunteer. And we were there Monday through Friday, 9 to 5. So next day, hey, Mr. D, oh, yeah. So then slowly, a couple weeks later, he's like, okay, they're actually here. They actually care about me. They ask me every day. So our CHW was building this relationship. And then she noticed his shoes. He had an off gait. His shoes, actually the heel of his shoe was cut off in the back. So here, he had a size like 15 triple E foot. I never even knew that there were feet that big. And he was wearing a size 12 size shoe. So how pleasant would you be if you were walking around every day wearing a 12 size shoe when you were 3 sizes too, 3 times, your foot was 3 times that size? Would that be comfortable? Would you be angry at the world every single day? So we found him 2 pairs of shoes, 15 triple E shoes, gave him those shoes. And then ever since that day, it was like a different person. He was talking to us, telling us that he has a family, that he just wants to reconnect with his mother. But because of his struggle with his substance use disorder, his mother didn't want to talk to him. So we said, okay, you want a relationship with your mother. You know that this is why. Okay, let's start getting you an NA treatment. Let's go see what we can do. So we started going to NA groups, going to mental health treatment, going to primary care. All because we took the time to figure out who he was, what was going on in his life, and it was simply a pair of shoes. But the entire healthcare system, the entire social service system gave up on him because of his demeanor, because he was angry and mean whenever someone interacted with him. So I share that story to tell you that sometimes it's just that simple thing when we get down to the humanity of a person that truly makes the largest difference in their life. And that's why, and I have countless stories from that experience, but that kind of has shaped kind of how I've developed into the psychiatric nurse that I've been. And unfortunately, that program didn't continue because it's hard to find public health funding. We were young. They're like, well, you can't demonstrate a return on investment, so we can't see the long-term impact. I see my colleagues here who've worked in the community, they're like, yep, that's the typical story. No one wants to fund public health. So one of the biggest lessons from here was failure. Now, I've had a lot of failures in my career at that point, but one of the biggest lessons was to embrace failure as a critical means of personal growth and development. As a registered nurse, you have to take the NCLEX, which is the board examination you take to get your RN license. I failed the first time. I'm still standing in front of you today as a registered nurse, but it took me a long time to accept that, to tell people that I failed because of the judgment or the shame or the guilt you feel like I didn't pass the first time. But you still become a nurse. You might not pass the MA certification exam the first time, but you'll still become an MA. You might not pass the psychology, you might not pass your exam the first time, but that doesn't mean you're not going to pass the second exam. And when you fail at something, whether that's not getting elected to a board or in an organization or not getting the grant to continue the work that you're doing, there's more lessons from that about how you are as a person can change, how your program or your approach to leadership or your approach to managing situations changes because you weren't successful. So really never turning away from failure, accepting it, acknowledging it, self-reflecting, working with your mentors, and not letting it change who you are as a person, but rather manifesting that to become your true self. All right. So kind of what's going on now. Sorry, I forgot all these little graphics were in there. So just a little bit about kind of my clinical practice. So I told you that I worked in a homeless shelter. I also work in inpatient child adolescent psychiatry. where I work in predominantly with teenage girls is predominantly the population I worked with. So it was a multidisciplinary care team: social workers, nurses, psychologists, psychiatrists, music therapists, dance therapists, you name it. They were the individuals that we were boarding in our team. So at this time, it really showed me what it was like to work with other professions, what it's like to build rapport. Sometimes the most valuable lessons are learning what not to do than rather learning what's right to do. And to be honest, that's why I chose to work in a community-based psychiatric setting, because I didn't want to be in CHOP or Penn Medicine where everything's, air quotes, done right, because it's not done right. I wanted to be immersed in a setting and a system where I knew it needed change. I knew it needed improvement, but how am I going to improve something if I haven't worked in it to understand where the issues are, the gaps are, the challenges related to the workforce, related to treatment, related to what that population, children and adolescents, were struggling with, what their families were experiencing. And at the same time, I was working full-time. I was in school part-time, getting my master's degree in health leadership because I didn't want to be a nurse practitioner. I knew that. I was still trying to figure it out, so I did a leadership generalist master's degree where I began honing these skills of critical thinking, quality improvement, how to negotiate, which I'm still horrible at. But my fiance is the negotiator, so whenever the contract for the job comes in, that's who gets that to make sure I'm not getting taken advantage of. Change management, kind of all these other macro level things that drive healthcare, because it's not something I was taught in my undergraduate program as a nurse. You know, we're not taught how the system's financed and how the sausage is really made in healthcare. We're told how to deliver care, but not really all of the things that even allow us to do that or not allow us to provide care in certain ways. And then probably the coolest thing at this time, how much more time? Okay. Was I started teaching clinical to undergraduate nursing students at Penn. So I was teaching community health and psychiatric nursing, and I was able to teach at Kensington Health Science Academy. I was able to teach clinical where I was taught clinical as a student, and that was just so powerful for me. And Mrs. Colleen Orr was the instructor at Kensington when I was teaching clinical there. So it's just, again, that kind of your network, nursing small, CTE's even smaller, Philadelphia CTE and nursing's even smaller. So I'm very thankful for that family. So that's kind of that part. And then at this time, it's kind of like capitalizing on your strengths and weaknesses, knowing what you're good at. You'll always be good at what you're good at. And I think we often focus on that because it makes us feel good. When I passed NCLEX the first time, I was really good at certain body systems and specialties. So I always took the practice tests that I would get hundreds on because I'm like, oh yeah, I'm ready for the NCLEX. And then I failed, and I was like, okay, clearly there's some gaps in my understanding. So I went to the Learning Resource Center. She said, take a test in every system, the ones you're good at, put them aside. The ones you're not so good at, endocrine, neuro, all that really hard stuff, pediatric cardiology, not cardio, pediatric cardio. And I spent the most time there. Because sometimes, again, you'll always be good at your strengths, but focusing in on honing those weaknesses might turn into strengths, they might not, but at least you can acknowledge it, you're aware of it, and then you surround yourself with individuals who balance that out. So I'm going to use type A personalities for the sake of ease, but I shouldn't be in a team of all type A personalities because we're not going to get anything done. I need people with type B, type C, type D, because they balance out all the things I'm not good at, and then I can balance out all the things that they might not be good at. So really recognizing and embracing weaknesses are really important. This other important piece of advice is, does my voice matter? And yes, it does, especially as a underrepresented, diverse person. I was talking about your lived experience earlier. You walk into these rooms, whether it's a classroom, in a community organization, as you progress through your career in boardrooms or in patient settings, and you kind of always question, does my voice matter? Because when I speak up, nobody hears me. Nobody listens to me. And I'm here to tell you that that is not going to change as you continue to progress in your career, but owning the fact that your voice matters and having the confidence to still speak up even if nobody's listening, because eventually someone will listen. So never let someone put out your fire. because you're going to experience this fear, intimidation, this marginal. You're too inexperienced. You haven't been a nurse for 20 years, so what do you know? But I come from a single parent, low income background, bi-rate, all of these things that you will never understand. And that's why I have a better rapport with my patients than you do. And they struggle to wrestle with that kind of dissonance or that issue that they're having. So always speak your truth, ask questions, be consistent, leverage your experience, your expertise, and learn how to navigate the politics. Unfortunately, sometimes we have to learn sometimes you can't hate, well, I'm going to say this wrong, I always do it. Don't hate the player, hate the game, and we have to learn how to play the game. So then kind of where I'm at now quickly in my last kind of 2 or 3 minutes is how did I get to pursuing a PhD? So I told you I was an inpatient psychiatric nurse and I was seeing all of these patients and families constantly being readmitted to the hospital, having poor care coordination, not getting access to outpatient treatment, not getting to the support that they needed. So I began asking all these questions and one of my mentors said, well, you have to get a PhD to answer this question. And so my interest in really understanding children and families and mental health care systems was really important to me. And my dissertation actually focuses on specifically the role of parents in adolescent suicide prevention. So not how can only work with young people to address the issues that you might be facing or how do we prevent suicide among your population, but really how do we leverage parents? Because when you leave a hospital or an ER, it's your parents that have to support you, get you access to care, watch you in your home, maintain your safety. And I was finding that we never ask parents how they're doing, how they need support, how they need help. So I'm really interested in focusing on how we can better support your parents to communicate with you. What does that look like? How do they improve your relationship? Because again, as we talked earlier, some of these things are just normal teen development, but we don't spend a lot of time working with parents, as you're coming through the primary care system about all these things to expect as you grow and change and figure out who you are. Whole system of support that we need to figure out, not just the person that's receiving services, because there's a whole community behind who supports young people needing care. So that's kind of how I got to the PhD. And then really this interest in how do we advance diversity, equity, and inclusion. So you heard from my work, I've worked in very under-resourced settings where there's not often people that look like the community that we're serving. So I really got interested in how do we diversify the workforce? How do we make sure that there's people that look like all of you that are providing you care, and then when you're there to ensure that you're providing care for the same population, because we know it makes a difference. We know that when patients have providers that look like them, have the same lived experience as them, that they do better. They engage in treatment. They have better outcomes. So I've done a lot of work nationally to ensure that we take down these barriers, both within the nursing profession, in healthcare, and in education, to ensure that all of you continue your education, enter the workforce, have the support and resources you need to stay in education, to stay in the workforce, so that you can in turn go back, serve your community, and improve population health and improve health equity. So that's a lot of kind of the work that I've done kind of in that space to ensure that we can achieve those goals. And then my last piece of advice really is always grounding yourself in that diversity, equity, inclusion, social justice lens. We heard earlier about embracing the value of diversity of thought, experiences of people, understanding the who, what, why, when, and how that disparities exist. Because we know it's not just because someone is Hispanic or because they're black, but it's because of all the structural barriers that have been put in place where folks can't get a good education, can't access care, can't live in safe neighborhoods. That's what drives poor health and poor outcomes. So really always thinking about the why behind everything, seeking opportunities to learn, creating safe and brave spaces for individuals, and just valuing each other's common humanity. So that's kind of just my 6 pieces of advice that I wanted to share with you all today about how to make the most of your educational journey, your career journey. And Dr. Graziani, I don't know if I put it, there's my information. If you want my email, I'm more than happy to connect with anyone in this room and offer myself to you so you can be your best self. Because I know in the future that you're going to in turn do that for other people. We have to pay it forward and give back. So you have to mentor folks too to make sure that we're continuing this pathway for individuals. So thank you so much.
Guess it's good. Okay. Okay. How's everyone doing? Good. Okay, very good. So our next talk is Esperanza is Hope, and I am very proud of being here to give this presentation because I'm not doing this by myself. I'm doing this with some of my students, so they will come shortly to speak to you as well. And our goal here during this time is to show you how Esperanza is hope. So many of you may be familiar with the fact that Esperanza means what in English? Hope, correct? So how many of you have heard of the concept of health disparities? And I think our speakers before me did mention it as well. So let me ask you this again. How many of you have heard of the concept of health disparities before? I hope to see more hands up, but let's go through first the definition, correct? So by definition, health disparities are differences among specific population groups that affect reaching full health potential, okay? It's measured by the differences in incidence, prevalence, mortality, burden of disease, and other adverse health conditions. And I know that's a mouthful, but think about what that means. And they can arise from health inequities, from systemic differences in the health of groups and communities due to the unequal positions in society. Now, this is an area or an issue that's under a lot of investigation right now. So there's a lot of researchers in the medical field that are gathering, analyzing, and compiling data and creating reports. So this is just an example of a report that's called Communities in Action, Pathways to Health Equity. So again, this is a field that has seen a lot of growth. A lot of attention has been called on this. Anyone wants to make a guess of what's one of the reasons why this has come to the forefront? What recent situation happened that made this so obvious that it was a big issue? Any guesses? Go ahead. COVID, correct? Yes. Okay. So, but we, as humans, when we are presented with a problem, what do we need to do? Look for solutions. We need to collectively, because alone we cannot do much, but collectively as a group, we need to look for solutions. So some ways to reverse these disparities include offering economic incentives to medical providers that serve underserved communities. You want to have good doctors that go to the remote communities or the areas where you have a high population of minorities or underrepresented communities. We can train community health workers as part of care teams to improve how patients experiences the quality of care. Why? Because if someone is there that looks like you, that again, as has been said before this morning, has experiences that are similar to yours, then it may be easier for you to understand what's happening. So that extra support of the community health workers is very helpful. And then last, we can create diversity in the health workforce with pipelines for underrepresented groups. So some examples of gender and racial diversity, just for you to think about. Latinos, we account for almost 19% of the population here in the United States. However, only 6.9% of US physicians are Latino. So I'm super glad when at this presentation, I can have some Latina representation. And Black population accounts for 14.4%, but only 5.7% of US doctors identify as Black. So again, that's why it's important to build these pipelines. In terms of gender, female or women represent only 37.1% of the physicians. So it's still a career that's dominated by men. So how can we change that? So we can all do a little bit, correct? We can all make a difference. And I want to talk a little bit about how we here at Esperanza are trying to move that needle, how we're trying to make a difference. So we, again, what's our hope? We bring opportunities to high school students, for example. So we offer summer experiences. In the summer, we have our STEM camp, where students come and for a week, they do research, and they learn many different skills that they can use to then find really good jobs once they go, once they graduate. Of course, it requires that you go to college as well. But at least it's, you get that started. Dual enrollment opportunities. High school students can come to the college, do courses. Some students come here and take 1 or 2 courses every semester from the time they're, some of them when they're sophomores, some of them when they're juniors. And again, that's starting to build up your college career while you're still in high school, and you do not have to pay for those courses. And we also have events such as the event today, our Minorities in Health Sciences Symposium. We're really excited that you're all here, and we are hoping that you will have a very positive experience here today. We also have other events, including our HOSA citywide conference. Save the date, January the 24th, most likely. That's the date that we have right now for the citywide conference this next year. We have our Health Career Series. So every month, from January through May, every month we highlight one health career. And those are offered both in person and virtual. So you can join virtually if you want to. And we also receive visits from schools to our Health Designs Lab. And you will have a chance to visit that lab today. Today it doesn't look the way that it does usually, but you'll be able to use some of this technology today. We also want to bring opportunities to the community. And these are some examples. We run summer camps not only for high schoolers, but also for elementary kids, students as well. So they come and they have fun. This is a collaboration with the Franklin Institute and GlaxoSmithKline. So we offer science in the summer. We also we've been participating in a project called Cities for Better Health. Our project is called Champions of Hope. And this is an intergenerational program for diabetes prevention and education. And we've done health fairs. We've done, here the students are doing a food giveaway, okay? Now, we also want to bring opportunities to college students. And our health sciences program, we have a health sciences program and a medical assisting program. Our health sciences program, the professors that teach in the program are professionals in the field. We have state-of-the-art labs and technology, and again, you will be able to taste a little bit of that today while you're here. We're student-centered, so we have small, engaging, and rigorous classes. And we are really big in providing the students with professional and educational opportunities for you to grow as a student and as a person. We do have clubs, and we have societies such as our Phi Theta Kappa Society. And one of our biggest clubs is the HOSA Club, so in terms of the health sciences and medical assisting. So I'm going to invite my students to come over and help with the rest of the presentation. So come on in.
Okay. Good morning, everybody. Okay, my name is Sarah Richardson, and I'm honored to be here today as the president of our HOSA chapter here at Esperanza College. This is my second year in the Esperanza's Early Colleges program, and I'm majoring in health science, and my goal in the future is to become a pediatric oncologist. It's also my second year with HOSA, an international organization that seeks those of us who are interested in the healthcare careers and pushing us out there to go network and make connections with other students who also might be interested in the health field. I chose to choose a career in health science because as a little girl, I've always loved science. I think it was probably one of my favorite subjects in school. And I always liked how science is changing. It's always evolving. There's always something new every day. So I knew I wanted to be a part of that in the future. But beyond science, I believe that my heart is really with the people. You know, growing up, I saw a lot of my family, a lot of my community struggle of getting quality healthcare, and not even just quality healthcare, but quality support. Getting that mental support aspect part of it too, because healthcare is not just about treating a patient and sending them out their way. It's about understanding the patient, having compassion for that patient. So I knew that I wanted to make a difference, and I knew I wanted to choose a career where I can have a feasible impact on these people in my community. I feel as though HOSA has given me the platform to engage with my community and also help me build connections, like I said, with other future healthcare professionals. From our chapter going gold at the state level, which is from last year, went fully gold, all medal gold last year, to IOC, where our school actually came back with a third place international medal in the culture disparities competition. We had such an incredible summer. It's probably an experience our chapter will never forget. We got to visit Houston, Texas this year, and the theme for HOSA was Dare to Create. It was a transforming experience, as like I said. It opened our eyes to a lot of new perspective because we got to meet a lot of people from different states who have a different problem in their state, and they got to communicate it with us, and we kind of got to understand each other, understand our ways, understand what's going on, and how can we have an impact as a youth, as a younger generation. HOSA has given me the most diverse, I guess, experience that I can ever ask for. We also partnered with the Champions of Hope program to help build our community garden in HOSA. And that kind of goes to show like how much impact HOSA has had on me and my chapter members. The fact that we can sit here and partner up with other programs to help better our community and help get that information out there to people who probably don't know what they're working with at home. So there was that. We also volunteer for health fairs a lot. We did the Esperanza Health Fair around maybe like March or May, where we got to pass on valuable information about diabetes and mental health awareness, and just all about kind of connecting with the people and telling them about what can you do to make an impact in your community, not just us speaking to them, but also what can you do, what can be transformative to help you have that impact in your community. HOSA has been really helpful and crucial to my life. It helped me grow as a leader and as a future healthcare professional, and my time at Esperanza College and in HOSA has really helped me combine my passion for science and to have an impact on the community. And I'm kind of dedicated to serving my community, and I know like this is the path I want to go down. This is the path that I want to, eventually see myself in the future for a longer run. I want to go get my PhD. I want to go do all those great things, and I want to come give it back to my family. And I want to show them that you deserve the quality healthcare that you need, and you deserve to be seen and heard. Thank you. So up next, these are our Pathway students. They're going to talk a little bit about their experience of coming into the Pathways program, which is a fairly newer program here at Esperanza College.
Hello, everybody. My name is Puralis Peña. I am part of the Esperanza Jefferson program, and I'm here with Jasmine and Kendra as well. We all work in hospitals around the city, which I work in Jefferson, Frankfurt, and they work at Jefferson, Einstein. They'll get a little bit more into it, but I'm just going to introduce our program a little bit. So our program is specifically designed for high school seniors in the health trade interested to pursue careers in the healthcare field. The program helps students secure a full-time job at one of the Jefferson hospitals while also attending here at Esperanza, a full-time student, to earn your health sciences degree, your associates. This is like a unique blend. It's all new. We're the pilots. And you get to earn your work experience and your education at the same time. We work full time and come here. It's a little bit overwhelming sometimes, but we get through it as a group. Dr. Graciani and Miss Jessica, they have structured this program in a way where Jefferson also covers a portion of our tuition, which is very, very financially accessible for most of us. Throughout this program, you gain essential skills and knowledge to help many medical professionals in the field. Some of these include vital signs, patient monitoring, also mobility access, and many more. We also do basic medical procedures such as EKGs and phlebotomy. Additionally, you can learn more medical terminology, professional work ethics, and also patient interactions. By joining this program, you're not only preparing yourself for a future career, but as well, you gain eye-opening experiences where you can see yourself differently, see other people differently, and it changes your perspectives. As well, you leave memorable marks on other people's lives.
Hi, my name is Kendra. I work at Einstein and Jefferson Einstein, and I'm also a PCT. So, okay. As PCTs, which abbreviates for patient care technicians, we are health professionals who have proven to not only be able to handle but assist with difficult tasks at hand. As a PCT, being a PCT at a young age, it has exposed me to much experience I didn't think that I would have, and a lot of experience that my family didn't have, who are also in the medical field, so they do applaud me for what I am doing right now. So our job as PCTs have a lot of responsibilities. You know, we are older now. A lot of you guys are older. So some of our job description involves taking vital signs at times given. We have to check blood sugars regularly for those who need it. What else? We have to learn how to do phlebotomy. You guys will be drawing blood and running labs to like blood banks and the labs so that they can, you know, do blood counts and everything. And you guys will learn the different types of colors if you guys already don't know that. In addition to that, you guys will be learning how to transfer patients and help with mobility, like physical therapy, helping to like help the patient walk up and down the hallway to practice walking, because being in bed for a long time makes them weak and, you know, they're not using their legs. So that's a good way to help them practice. Another thing that we also do is, unfortunately, during a code, we have to be on standby to do CPR. Those who are CPR certified knows that resuscitation takes a lot of energy and strength, and it takes a lot of heart, because you have to keep your feelings in check. So I feel like that is something that I've learned and grown into, because I would get overwhelmed and not be able to perform properly, but as doing it multiple times, I've learned to control my feelings better and learned how to resuscitate properly. Lastly, I want to talk to you about 101s. 101s aren't usually given to us because we have something called sitters, where their job is usually to be a 101, but if needed, we will step in to be a 101. A 101 sits and observes the patient closely, whether it's for safety, suicide, or just regular observations. Our job is to monitor the patients every 15 minutes. So every 15 minutes we are checking whether they're in bed, whether they're outside, whether they're in procedure. And, you know, you follow them wherever they go, whether it's for a scan or whether it's for, you know, just assist them to the bathroom. And I feel like this is a good way for us to properly connect with our patients, along with closely monitoring them and keeping them safe. So I really do like doing that, because I like talking to these patients. They tell me about their life stories, and, you know, you always learn stuff from older people. Like, you probably don't believe it, but I do learn stuff from these like older patients, and it's interesting hearing about their life stories. Like, I heard about this guy who was in the Navy, and he told me about his experience, and then it was just It was interesting because my brother is also in the Navy too, so I was just relating that to something I know my brother will be involved in. So I just want to say that a shout out to my high school, which is not here, Kensington Health Sciences Academy. They did a great job preparing me for this, educating me in health sciences and making me stronger, and just, just having my back and supporting me in this decision of joining this program. And I feel like it's the best decision I've done, and I will advise any of y'all who are interested in joining the healthcare field to join this program because it is a very good opportunity.
Although choosing this program was not the easiest decision, I'm glad to say that I committed to the Esperanza Jefferson Pathway program. Being a part of this program has brought me hands-on patient care and the ability to gain prerequisites in math, science, and English, ultimately setting me up to any future health profession that I choose. It is always rewarding being able to put a smile on my patient's face and being able to brighten their day. I would be lying to you if I stood up here and said every day was easy. I'm currently working at Albert Einstein Medical Center, and some days do become very overwhelming. From the different things that I experience at work to the people that I may encounter. But what I can say, though, is that being a part of this program, you gain a great sense of community. Being surrounded by people who are going through the same exact thing as you helps keep you pushing. We motivate each other, we vent to each other about our bad days and experiences, and we keep each other motivated to do our schoolwork. Overall, this program is a great investment to our future with amazing mentors and great friends made along the way. Thank you.
All right. So, again, I hope that that I was able to impart our goal, which again is to show you how Esperanza is hope. You have to think that each one of you sitting here is hope to others. You represent hope to others. So let your light shine. Follow your dreams. Continue your academic career. Seek out any opportunities to enhance your education. Okay? And believe in yourself. If you do, you will be unstoppable. Okay? Thank you. Now we have one more speaker. And yes. So I am very thrilled to introduce Dr. Janet Cruz, who is a board-certified family medicine physician. She obtained her medical degree at Rutgers, New Jersey Medical School, and residency in family medicine at Eglin Air Force Base. After completion of her training, Dr. Cruz served in the United States Air Force in the United Kingdom and the United States from 2013 through 2017 as a medical director and a staff family medicine physician. During that time, in addition to clinical responsibilities, she coordinated training programs for wartime contingencies, humanitarian assistance, and disaster relief response. Dr. Cruz most recently served as medical director to the Student Health Center at Drexel University and is faculty for the Tower Drexel Family Medicine Residency Program, practicing in Philadelphia, Pennsylvania. She was instrumental in operationalizing the university response to and served on the front lines of the public health COVID-19 pandemic. She has now transitioned into a new role as program director to the Temple Northwest Community Family Medicine Residency Program. She is the co-author of To Stay in Medicine, a guide for physicians to combat burnout and bring change in the medical industry. Of Puerto Rican roots, any Puerto Ricans in the house? Dr. Cruz is passionate about diversity in medicine and increasing access for underrepresented minorities in the clinical arena. Okay, I know that we've gone straight. This is the last talk. If you must go to the bathroom, then try to be as quiet as possible as you come down the steps, please. She currently lives in the larger Philadelphia area with her husband and 2 children, and she will talk about turning life experience into your superpower, building skills for a future in health science. Let's welcome Dr. Cruz. Do you want to use?
I'm good. Is it on? Yep. Okay. So I know I have the toughest job right now. I stand between you and lunch. Toughest job as a speaker. I get it. So before I start my talk, there's 2 things that I want you to do right now. I want you to look to your left, and I want you to look to your right. This is a community. Whether you see it or not, these are people that are like-minded, that want to do maybe what you want to do, right? So this is a community, and now I am part of your extended community, all right? Lesson number 2, when you're trying to learn things, and you've gotten so many good nuggets today, right? If you combine exercise with learning, your chance of retention, right, to really understand it, goes up. So this is my ask as my new community members, all right? I need a couple of you to come down here with me and do 5 push-ups. Come on. Come on down. Just come on down. Let's go. Okay? Quickly, quickly. I stand between you and lunch. Come on. Okay. For those in the audience, okay? You have 2 options, okay? You're gonna stand up and stretch, or you're gonna turn around and do, actually no, you could do 5 squats. Okay, here we go. Come on. Push-ups. Come on down. All right. All right. So that gets the blood pumping. So as you go through, what I'm going to do today is talk about how your life experiences are your superpower. Oh, I guess I flipped my pick. So let me tell you a little bit about my origin stories. So I know that I was already given an intro. I'm an author, I'm a family physician, I'm a veteran, I'm a mom. But before all of that, there was a lot of steps between, my upbringing to get me there. So I'm a daughter to Puerto Rican farmers, maybe 6th to 8th grade education, right? That came to New Jersey for a better life. Debatable. We lived in a house that was soon to get condemned. I learned that we had to put plastic on the windows because that winter, cold. I learned to put cotton balls in my ears, because roaches, right? And I feel like it's important for me to share that because when I was younger, when I was sitting in a crowd just like you, there was no way. I was like, I'm not going to be a doctor. No way. So I think it's super important for you to hear that everyone here, you guys have superpowers. There's a way to get to where I am for those that want to go there. And for me, my introduction into medicine wasn't because I had someone in my family that was a doctor or a nurse that shared crazy stories. I actually have an experience that probably a lot of you guys have. I was the translator. That was my first time being in a clinic setting where I wasn't the patient for my dad that was half naked, awkward at 12, by the way, right? Trying to focus and understand what that physician was telling my dad and translating. Medicine is a whole different language, right? And then my dad asking, pero qué dijo el doctor? Well, he said there's something wrong with your back. And then I would go back to the physician and say, hey, can you say that again? And the physician would say, all these things that now I know what they are. He has a lumbar, blah, blah, blah. And I would turn to my dad and be like, tiene algo mal con los discos. Those that speak Spanish, no, that was not what was translated, right? So that was my first experience in medicine. And I share that because, it's an unorthodox or not the common experience. But there was a lot of jobs that I have just like you guys have, right? There's a lot of jobs that maybe you guys do out of necessity, out of survival for your family, or just because you need to work. And I think the problem that, I'm a mentor, I mentor medical students, undergrad students. They don't see this as a way to obtain skills. So let me list my odd jobs. These are all jobs that I did prior to medicine, right? I told you I was a translator. I had to listen. I learned tons. I was a secretary assistant a couple hours after school. I had a lawyer that, needed me to do documents. I learned to pay attention to detail. Let's talk about resilience. How many here play sports, right? How many times do you say, you know what, I'm exhausted, but I gotta push through? I learned resilience. Boys and Girls Club, so I had the distinct honor of being a camp counselor. For those that have done it, it is chaos and so rewarding. I learned empathy, I learned patience, I learned to listen to the kids that were telling me that they had experiences like mine, right? Help them through their anxieties. I was a house cleaner. So my mom cleaned houses. My mom worked cleaning houses on the weekend, working at Burger King during the week. My dad was a janitor. And we helped them. And there's two things that I learned. Yeah, work ethic, absolutely. It's hard work. But you know what? I was going into these houses cleaning for people that were so just pillars in their communities. And guess what? Their house was a mess. And it humanized it for me. I was like, you know what? You can't be good at everything all the time. They need help too, right? That's why I'm there. I was a waitress and a bartender. Talk about time management. Going through, trying to figure out, okay, what did he order? Right? Or the patience that you have to have as a bartender when someone is a little inebriated and their dentures fall out. And you're like, oh, sir, can I get you some water? Right? The humility to be decent to people as they're talking. I learned through all of that. And as you can see, none of this involves medicine. So how many of you here have had experiences where you are the people that are creative in your family, that you bring parties together? Right? That is a skill. How many of you here have had odd jobs that are not really sexy, right? Not really enticing? There are superpowers hidden in that. And then my last job, which does involve a little bit, of medicine, was my time in the military. So I learned to think in systems. I know how to mobilize a group of people to have them work in the same mission, right? Those are skills. So take a minute, take a second, think about those experiences in your life. What are your superpowers that you have right now? Okay, so what makes an excellent physician? I tapped in AI for help, because we gotta use AI, okay? I asked AI, what makes a good physician? Look at the stuff that's listed there. Resilience, problem solving, attention to detail. Where did I get those skills? Not medicine, not medical school. That's right. So, and obviously medical knowledge, right? So that is my point, that there's a lot of things that you already possess that you don't know about. All right, so we're in the training of being superheroes. Superheroes have mentors. They have people that guide them, that tell them these are the things that you need to do, right? So in training to hone in those powers, that you currently have. It's also acknowledging that there may be areas where you need to improve and you need a direction, right? We don't want to be on the left, that we're a leaf just blowing in the wind, right? For those that have goals and they know what they want to do, all right, there's a couple tactics that I'm going to tell you right now that actually our speakers here have already mentioned, a lot of them, on how to get there. So I'm going to put my doctor hat on now. So I've gotten the chance to be the student's doctor, right? I worked at a university where I was in the student health center. I've taught medical students, pre-medical students. I'm teaching residents now. So there are 3 big take-home points. So if you are going to write anything down, these are the 3. What is your goal? How many people here have goals? Hands way up. Okay, how many have written them down? Woo, those hands went down, a lot of them went down. How many have told other people about your goals? Oh, good, great. You know how I ended up with the opportunity to do medicine? I talked to my coach about what I wanted to do, right? I want to be a doctor, I want to go to college. The assistant coach, I had no idea, was a physical trainer at UMDNJ, now Rutgers, but I'll stick to UMDNJ. She told the assistant trainer. 2 months later, I was meeting with the dean as a medical student, not knowing how the hell I got there or what to say, but making your goals known. There's a network out there that is a lot larger than the people just sitting here in this room, okay? I love data. Being a science person, I put a little data in there. People that write their goals, people that share it with others, have an accountability partner, they have a better result in actually getting it done. For those that are looking for the why, so my colleague here already explained the why, right? We know from the medical literature that when we take care of our communities and the physician or the care team looks like us, has a shared experience like us, they have better outcomes, right? So these are just 2 demonstrations. We know that for our Black communities, for our Latino communities, for our Asian communities, when there is concordance, right? When there is shared experience between the physician and the patient, we keep them out of the hospitals. They come to actually see us, they actually listen, right? So for those that are looking for the why, we need you. On the right is a picture of my residents, which I call the Skittles family, because we are all a little different, we all learn from each other, out in the community, making sure that they're getting their preventative screenings and they're plugging into a physician. Lesson number 2, you need a tribe. You can't do this on your own. You could try, but at some point you're gonna need some help. So we talked about mentors and leaders, right? I will encourage you guys to find mentors, yes, that have same common thought, but maybe find some that don't. I didn't get into medicine, solely on people that think the same way that I do. In fact, I sought a lot of advice, especially when I was in the military. No one looked like I did. I was the only officer that was Latina, the only officer that was a female. You have to seek out also advice from people that don't look like you. You're gonna need emotional support. And I say this because a lot of the emotional support for some of us come from our family, come from our friends. For people that are going into medicine, not everyone knows what you're gonna go through. My sister was fantastic. My friends were fantastic. My mom, I love her to death, was not fantastic in my journey because she would see how hard it was and say, "Ay, Johnny, why are you doing this? You could do something easier. You could be a secretary, but I really wanted to be a doctor." So sometimes that support, that emotional support, is a coach or someone to say, "Look, today's a bad day. Let's start this again tomorrow." Right? So look at what that village looks like, what that team looks like. Resources, you've heard our colleagues here. The program that is being done here is absolutely amazing. I was part of those programs as I was looking through medical school and those opportunities. The one thing that I will emphasize is academics, okay? Again, I have my being the student's doctor hat on right now. A lot of what I saw, especially from our underrepresented individuals in medicine, is they didn't know how to study in college. The stuff that worked for them in high school isn't working for them now. Yeah, because y'all are really, really smart. And you find workarounds, and you find a way to get the job done. But then when the volume increases, yeah, you got to pivot. You got to find people that are doing it well, and then ask them, all right, how'd you do that? No need to reinvent the wheel. That's what I did. And then looking at your peers for support, and then your networks. That's the whole point of something like this. You are going to start creating your network today. My last lesson, being the student's doctor. You got to learn how you learn. I didn't know I was an auditory learner, meaning when people tell me something, I will remember. If I read it, I got to read it like 3 times, okay? Some people are visual learners, right? Some people need a mix of, all the above. This is the time to kind of explore that. And then acknowledging, hey, what worked now and doesn't work later is not a failure of you. You just need to pivot. You got to learn new skills. That's okay. And then the last one, seek help early. I do a lot of these talks. I give my email, I've given phone numbers out, and it's just a very small amount of people that actually reach out. The individuals that are speaking to you actually want to help. We were in those shoes. I just told you my story, right? I had a lot of people that helped me through. Academic help, don't wait until you fail a semester or fail a course. That first test, or that, when you get work and you're like, I don't know how to do this, that's the time. Get the help then, okay? You guys have to take care of yourselves, especially as you go to college or wherever your careers take you. You got to physically stay healthy too. Exposure. This is the point of these kind of symposiums, and I just heard about this amazing program. Be in the spaces that you eventually want to lead, right? So if you're an MA, if you're a volunteer, great. You know who you're going to be working elbow to elbow with? The people that you're trying to be, or maybe be their boss, right? So being in those same spaces, there's a lot of information that's exchanged just by being in the same space, right? For, hey, how did I apply for this loan? Or, hey, what scholarship did you apply to when you were doing all of this? That information is easily available. You got to be in that same space. Financially, I think my parents made maybe $19,000 a year, if that, when we were growing up. I needed help. I had to find scholarships. I joined the military. I don't recommend that as the end-all be-all, please. But there are programs out there that will help you. What I see when I'm coaching, when I'm mentoring, people just don't even ask, okay? And then coach. You need to find that one person, maybe 2 people, maybe that mini village that's gonna give you that motivation. Say, all right, look, I get it. All these things are happening, I get it. You gotta keep moving forward, okay? So those are my 3. If there's anything that you take away from my little talk today, is those 3. That's it. That's all I got. What questions do you have? Okay. All right. Yeah. And then I'll be down here if you have questions for the next 5 minutes.
All right, can everyone sit back down, please? Thank you. So first of all, I would like to hear a really big round of applause for our awesome speakers this morning. Thank you. We are going to dismiss in a specific order, so please listen. You will go to the, for those of you that are Esperanza Academy students, You are dismissed. You will be dismissed now. You will go back to the atrium. The ambassadors will take you upstairs to the grand salon. You will grab your lunch in the grand salon, outside the grand salon, and then go in. Okay? So all right, all the high school, Esperanza Academy high school students are out. So the other schools, you will leave with your ambassador and your teachers. You will pick up your lunch at the atrium, the same space where you register. These are bag lunches, so you can go and pick your lunch, and then you all should have a name tag. If you don't have a name tag, your teacher has your name tags. Where are your name tags? You have a lanyard in your bag, and your teachers have a folder with name tags. Could you please hand those out before they leave this room? Because they'll need them to know where they have to be. The back of that name tag says what spaces you need to go to. Inside your bag, you also have a lab coat, you have protective glasses. When you go into the labs later this afternoon, make sure that you wear those, please. There should be a lanyard in there. Yeah. Look in the bag, yes. What?
They got up and left.
Who?
Edison.
That's fine. So you found your lanyard. Look very well. They all should have lanyards. Okay? All right, and your teachers have your IDs. Once you have that, you can go ahead and then move to get your lunch. mis estudiantes se me fueron.
You want them up there so I can
Yeah.
After picking up lunch, we go to the breakout area, correct? Got it. Got it. Thank you.
Thank you.
Were they good? Did they have the stuff that they?
Yes, yes.
Mm-hmm.
Where are we going? Do you have a schedule for the symposium? Right here.